I think that I would like you to come away from this understanding that your top marketing strategy is actually your patients first and foremost. A certain amount of this derives from these studies, and everybody that's listening today, if you're not from the U.S., then it may be less familiar to you, but most of us have to do these patient satisfaction surveys, and we know that the ratings that we get are entirely dependent on how many of our patients give us a 5 out of 5 rating. And I want to give you the origins of this. And if you're not familiar with your patients or with your hospitals, then if you've had your car serviced recently or if you've bought any product at all, you will know that they're constantly after you to say, how many stars would you give this? What kind of rating would you give this? And this was the study that drove this. And this is many, many decades old. But Xerox did a study in which they found, this is back when Xerox was making copying machines, so that'll tell you when the study was done, that those customers that they had that gave them a rating of 5 out of 5 were 6 times more likely to refer business to them or to buy a second copy machine or another Xerox product than even those who gave them a rating of 4 out of 5. And so it is from this study that this whole notion of getting a 5 out of 5 rating has derived from Press Ganey and from every other business that evaluates us. Of course, things are very different if you are if you're a Xerox machine than if it's patient care, or you may have only one insurance company, you may be insured by somebody that's driving you to a certain hospital. And so we understand that the studies that were done by Xerox may not have the same impact in every industry. And in fact, this slide here shows you that depending on the type of industry, the rating may be very different depending on how competitive that business is. But still, the basic concept is there that we get referred people from the people who we see, and that's going to end up, their satisfaction is going to be one of the things that really drives business for us. And getting satisfaction and loyalty has 4 components. One is the basic element of service or product. So, if you have a copying machine that is constantly jamming, constantly needs service, nothing else that you can do is going to save the fact that that service or that product is not good. And the same is very, very true for us as physicians. First and foremost, we have to deliver quality. We have to take good care of our patients. But there are many, 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 many doctors who are great technicians, and then there are not as many who are great technicians, but also very, very good, take very good care of their patients in the global sense and are good communicators and that sort of thing. But that's an essential element. Then you need to have basic support services. And this is increasingly true for us as surgeons, and especially in the era where patients have immediate access to their medical records, and they read an MRI report and they want to know what certain words mean suddenly. And so they want service, and we as physicians can't always be as available as we want to for these. So you have to build into your practice the basic support services for, when things go wrong, when there are questions, and when they feel that they need to reach you. Because even if we know those words are not important in a radiology report or in something else, the patients may not know that, and they want to get that answer, and they want to be served. The next element is a recovery process for problems. So, when a flight gets canceled because of weather, or when something breaks down, or when something doesn't work as it should, how can you get that taken care of? Is it difficult? Is it easy? Is it obvious how you can do this? And so that's also an important part for satisfaction and loyalty. It's been shown that having complications or having problems or have something break down is not so much of a problem as what you do when that happens. I recently had a patient, we put him to sleep. We were about to start the procedure, and we had a very serious technical problem with one of our pieces of equipment, and we had to wake him up and reschedule his surgery for 2 days later. Needless to say, I was, beside myself that this had happened and that it had not been, we had not found it before we put him to sleep and put a Foley in him and put an A-line in him. It was for a major procedure. And I spent a lot of time. His surgery went great 2 days later. And I've spoken at length to his wife. I brought one of my operating room administrators with me when I spoke to the family. And then the administrators went and separately went back to the family and to the patient. I don't know. I mean, it remains to be seen, but I believe even though we had a real technical issue, that our recovery process for this was sufficient. And then there's something else where you just have to have extraordinary service to make each and every customer feel special. And that's a little bit more difficult. Two pitfalls with patient satisfaction is that patient satisfaction by definition is always measuring something that happened before, and it's usually 6 months or 12 months behind. And so you can't rely exclusively on patient satisfaction because it's something that's historic by the time you actually get that data, and you may have made changes or there may have been changes made in your office. So for instance, you may have had good reviews, but you may have a new front desk person who's really belligerent and isn't treating your patients well. Just because your reviews were well, if you sense that there's a problem, don't ignore that just because of past data. The other thing that I would like to discuss just for a moment is wrong patients. They take up disproportionate resources. They impact morale and they disparage the practice. We all know them. So when you operate on the wrong patients, they drain every part of your practice. I once had a patient who, even though their surgery was successful, the benign tumor was removed, they had no complications from surgery, they were just such a difficult patient. They called the office 5 or 6 times a day. My nurse, who was a great nurse, actually came to me and she said, I'm ready to quit because I cannot deal with this patient any longer. That was how demoralizing it was. And so we had to develop strategies so that we could get the patient what she needed, but no longer have all of those resources be contained. After your practice has matured, at least 60% of your referrals will be connected to one of your other patients. And the longer that you're in an area, the higher this number will be. I mean, even if it's not a direct referral, I mean, I frequently, will hear the comment that, I was told I needed to see a spine surgeon, and I was given 4 names, and I asked around at church, or I asked around, at my health club or whatever else, and several people said that they knew you. So you want to know what your reputation is in the community. Are you fast to operate? Are you over-aggressive surgeon? That's going to drive people away from you. What do these people tell their primary care doctor about you? Now, some of us right now I work in the Cleveland Clinic where many of my referrals come from within the Cleveland Clinic, and that's different, but I still get referrals from outside of here. And most of us work in communities where a lot of our referrals come from primary care practices and neurology practices. And what your patients tell those doctors will have a really big impact on whether those doctors will send you their future patients.